Okay, wow, this is crazy. Somebody listen to me. So here she is 6 months later for a BBL, and I did just what we call a tummy tuck too. So this is what I always recommend. I always recommend do a tummy tuck first, get rid of the skin. That makes you into a liposuction or a BBL patient. And so I can do a better job if I separate the two operations. So here she is, she's healed. She's healed nicely. This is still a little bit red and it's still a little bit raised, and that's normal at this point. It'll still flatten and it'll still become a lighter color. But here's what I mean. So obviously she has these two large areas here. We knew she was going to have those here, but we were saving all this fat for doing the BBL. But here's where I can really make a difference is in the front. Now that all the blood supply is healed, it's safe for me to go back in and do lipo. So she actually has quite a bit of fat that's still here, even though when I do a tummy tuck, I always do some lipo, but I can never do as much lipo during the tummy tuck as I can now. So now we're really going to be able to get more of this fat. Remember, this was already lipoed. I'm going to be able to get more of this fat, lipo the whole abdomen, and then I'm just going to have you turn all the way around. And then this area, which obviously doesn't look good now, this is all fat. And that's all fat that's going to come out here, and her skin's pretty good. So this is going to shrink back down. So she's going to really look completely different. I'm going to do lipo all through here, the entire back. So when I did the tummy tuck, I'm going to have you turn around. When I did the tummy tuck, that's all we did. I just did the tummy tuck, got rid of the skin. And now we're going to come back and we're going to take the fat. And so that's why sometimes people will ask me like, oh, well, I want to do them together because I want to be able to use my fat. And if I have a tummy tuck, I'm not going to have fat. But that's not right. Having a tummy tuck, we just do a little bit of lipo. You can have a tummy tuck with more lipo. That I do. But the best thing if you're thinking about a BBL is to space them out.